Okay, so I'd like to welcome everybody and also say a very warm welcome to Monica. So Monica is a storyteller on the Care Opinion platform, a patient, but she's so much more than that. And we wanted to take some time having a bit of a talk with Monica to get an idea of her experience with sharing feedback and what this has meant to her. So Monica, did you want to start by introducing yourself a little bit? So I understand you were recently diagnosed with cancer at just 27 years of age, and I'd love to hear about you as a person and what your experience was like around your diagnosis and communication around appointments.
Yeah, so my name's Monica, obviously. I found a lump in my neck in November last year. I'd been working full time, I'd previously been very healthy, active, had no other symptoms really other than a little bit of itching, which I thought maybe was allergy related.
Yep,
Um, had a couple of months worth of back and forth test results, not really understanding or knowing what it might be. And eventually in
yep,
January, I elected to have an excisional biopsy just so we could actually get a good result.
mm-hmm,
Um,
yep,
the way that that usually works is that I had surgery and then I had a follow up appointment, a week and then 2 weeks later, and your results usually come out at some point within that time.
yep,
Um, the way that it ended up going was the hospital that, or the clinic that was seeing me, actually missed a few appointments with me. So I was told initially that I would get a call on a Tuesday, and that call never came. I followed up with them and they said, "Oh, our results clinics are on Thursdays and Fridays." So, as you can probably imagine, knowing that it was probably going to be cancer was a little bit of a, a scary
very
wait.
stressful. Yeah,
Yeah.
very, very
Um,
concerning.
and so eventually I actually got the pathology clinic to fax the results to my GP. My GP told me, this is a cancer diagnosis, but the hospital needs to sort out the referrals and things like that going forward. So
Okay,
I wait till Thursday for my scheduled appointment, and that gets missed. It was supposed to be a telehealth consult, and they just never called. So we
okay,
followed up later that day, and it
yep,
was, "Oh no, your doctor's been called away to an emergency. They'll call you later on that day." Emergencies
yep,
happen. Okay.
yep,
Um, Called back at the end of that day, and still, "Oh no, the doctor will probably end up calling you tomorrow." So um,
okay.
we rung first thing the next morning saying, "Hey, just wanted to check, roughly what time that might be."
Hmm.
And the staff were like, "Oh, well, we have no idea your appointment was missed. They didn't call you." So
Okay.
you start to get a bit worried that you've sort of dropped out of the system. And so they're like, "Don't worry, doctor will call you later." And then, by the afternoon, we sort of double checked again. And it's like, "No, no, the consultant will call you later." And I'd got a text message from them saying the consultant will call you. Never got called. So by Friday night, I'd found out a few days ago that I had cancer, had no idea what the stage was, had no idea how far it had
Okay.
spread. Um, and it's one of those things where
Yep.
it could have been quite a small thing, but it could have been quite a major issue. And that
Yep.
was when I'd sort of decided, okay, I really just want to be heard at this point. I know that I
Yep.
need a referral and a PET scan, and I just need someone to do that referral. And heading into the weekend, because I was going through the public hospital system, I thought I'm
Yep.
not actually certain that
Mm.
this referral is going to come through until Monday, or maybe not even till the next Thursday when they had their next results clinic. So you
Of
start to get
course.
quite worried. Yeah.
Yeah, no, fair enough. So you chose to share your story about this experience on Care Opinion, so our website. Can I ask, what was it that influenced you to go through a more public feedback platform that was also anonymous?
I think in the initial stress and desperation of a diagnosis, you just want
Mm.
to be heard. Um,
Yep.
I would say I'm generally a reasonably reserved person, but when you're sort of feeling desperate for healthcare,
Yep.
and especially in my case, I really didn't know if it was going to be life or death, how long you'd have to wait.
Yeah. Yep.
You really want to turn to someone to tell your story and to be heard. But
Yep.
um, I think after a little bit of time, I got a call saying that my referrals were going through the hospital system.
Okay.
And I think once I knew things were underway with the referral system, I got to thinking about the experience that I'd had and
Yep.
how the way that this particular hospital clinic were running their results clinics I sort of
Yep.
thought, well, if I've had my appointments missed and I had a start of the day appointment, how many other people have had appointments missed? How many other results maybe haven't come through because I got my
Yep.
result, days later, and then, oh, I got a
Mhm.
call from the hospital days later, and then my referral
Yep.
progressed after that. I received a call a few days after my scheduled appointment from one of the junior
Yep.
doctors. She was very apologetic that the results had been missed and
Mhm.
was going to progress my referral.
Yep.
But we actually ended up getting to talking, and she was telling me that a few months ago, the clinics had changed the way they were running. And so
Okay.
the junior doctors who were on call were also expected to be the ones to read the results and call patients. And so it was very difficult for
Okay.
them, obviously, to manage emergencies as
Yep.
well as, actually filtering results
Mm.
and calling patients. And especially if you have to
Yep.
deliver bad news, you need time to do that
Yes.
properly. So,
Yes. Yep.
with the combination of my own experience plus thinking, well, everyone who is going through this clinic might be experiencing this same level of waiting, maybe um,
Yep.
doctors constantly getting called away to emergencies, and then this junior doctor
Yep.
saying, well, this is the new system and we've tried to tell our consultants or our like senior levels that it's not working. And um,
Okay.
I've had some experience as a medical technician in the medical system. I know how it works. Sometimes you need a patient to actually speak up for a change to happen. And so, for all of those
Yeah.
reasons, I ended up using care opinion. Um,
Yeah. It's really advocating for staff, isn't it, as well? And I think that
mm,
sometimes um, not everybody understands that. I suppose patients don't always want something fixed just for themselves.
mm,
So, with your story, the story was posted, and you've had more than one response from the service or an executive director of that particular health system. I'd love to understand there was a bit of a dialogue going on. You made use of the ability to respond on the platform. Can you talk a little bit more about how you felt about the different responses? Because there were different approaches in the response in what was being done. Yeah, I'd love you to share what that was like for you as a person and obviously as a patient.
yeah. So, initially, I had posted my story, the experience that I had had with the clinics who pre surgery were really excellent. And I wanted to be very
Hmm.
clear that, some of the care that I'd received was really amazing. But
Yeah.
the way that I had experienced, and it seemed that this junior doctor had experienced how the clinic was running, there really seemed to be some room for improvement. So
Yep.
initially, I just shared my story. I'd also gone through the patient outreach team as I was sort of desperate to contact anyone.
Yes.
Um,
Yes.
so he had some awareness of my situation, and in his first response to me, it was very sympathetic.
Hmm.
Obviously the situation that I was going through is one that a lot of people have a lot of sympathy for. But
Yeah.
he sort of said, it's great that you're receiving care now, all the best. And I thought that
Hmm.
doesn't really address some of the issues that I've actually brought up, in that this clinic seems to be running in a way that doesn't make sense. And
Hmm.
from what you've said, some of your doctors are getting very stressed about how this clinic is being run, how they're expected to deliver results. And so
Hmm.
I ended up replying to him and saying, thank you for the well wishes. It's great that my care is underway, but could you explain to me what you would like to do about this system? We've identified
Hmm.
an issue here. What can you do about it? And again, the medical system, it works better if you can reach the executive level or consultant level. At the moment, it was just me as a patient talking to a junior doctor. There's not a lot of
Yeah.
change that you can make, but the fact that you can
Yeah.
actually reach someone on a higher level, that's how a
Yep.
system can be improved.
Yeah. So you felt once you'd posted that response back, just explaining you're really looking sort of, I suppose, more broadly
Mm,
for help for other patients, including the staff.
mm,
You got a second response then,
yeah.
and in that one, we could see that a change was underway based on that. For you as a patient, and obviously you're going through a fairly challenging journey personally, but you've also got that insight into the medical field. What did it feel like to see that the results of something where you've shared it about yourself, initially out of desperation, but then looking a little bit into the bigger picture. What was that like for you, to see that, you've talked about reaching somebody more senior, but then to have influence change?
Yeah, I mean, I think if you've gone through something that has been a bit of a horrible experience for you,
Yeah,
one of the
yeah,
things you want to do is try and make sure no one has to go through it exactly the same way as you if you can improve
yeah,
something.
yeah,
So yeah, I got an email a few days after I think it was my story was posted
yeah.
saying that a change has been made, and in the second response, he basically outlined the way they had restructured the clinic, that the on-call doctors were no longer the ones expected to deliver results. Um,
Oh,
and that was an extremely empowering sort of feeling, because
yeah.
sort of had actually been able to make a change, and that really does kind of give a bit of hope, but also a little bit of closure, I think, to a
Mm-hmm.
situation that's very difficult to go through. And I was very aware,
Yeah,
I guess, as well, that I'm a medical technician. Some of my support network are pharmacists and nurses, which is how I sort of found out about Care Opinion. And at the
mm-hmm.
time, I had reasonably mild to no cancer symptoms, so
Yeah,
I was in a position where I could respond to him. But if you had limited English, or if you had no idea how the medical system works, it would have been very difficult to actually respond, or
mm-hmm.
really even just tell your story. So
Yep.
yeah, it was really amazing to actually see that a change had actually occurred.
Yeah, yeah. No, and I understand that. And you're right, the feedback system isn't always particularly easy.
Mm,
And it's, I suppose, having those staff members being willing to come to the party and really engage with you and dig a little bit deeper, I suppose. It's obviously not always going to be the case that that can happen on the public forum, but I think
mm,
we often think about it as closing the loop on a situation
mm,
where feedback's been provided. So sometimes I suppose there is that value for the patient, the person sharing the story, to have that closed and go, okay, well,
mm,
it's come full circle and we can see what that is, and just walk away, with that closure, which is fantastic.
mm. Yeah.
So what I wanted to ask then, there are times where people share a story and maybe a staff member needs to investigate, but that person chooses not to make contact. For them, that they've shared the story, that's the line under the sand. What would you say, if you can answer this, to a staff member to help them understand why would a person choose to do that? So you talked about desperation before. Do you have any thoughts about why a person would not want to reveal who they are, or make that contact offline then?
Mm. Yeah, I think there's the main reason for that, and why I was initially wanting to remain anonymous.
Mm,
Um, I think is that many patients would feel like if they give poor feedback, if they say that a certain clinic or a certain staff member or staffing group, um,
mhm.
maybe has led to some sort of negative outcome for them, that they might
Yep.
somehow receive worse care going forward.
Yeah.
Um,
Yeah.
so if you have these very real and genuine concerns about, whichever medical system you're using, that
Mm.
you want to improve the system, but you don't want to be seen as just someone who's whinging or complaining.
Yeah.
Um, and I
Yeah.
think probably secondary to that, but along the same lines, is that, or another way that I've heard it phrased perhaps, is that someone's
Yeah.
honesty might be curbed if they put their name to a complaint. So you may
Yeah.
not actually
Yeah.
be as honest as you need to be if you feel like you're going to receive worse care or some sort of negative repercussion,
Yeah.
from not
Yeah.
telling the full
Okay.
truth. Um,
Do you think it
yeah.
would make a difference if the person responding to the story put any information explaining why they want you to make contact, or why it might be safe to do so? Do you think that would make a difference?
Yeah, I think part of it is understanding or humanizing the system, and not
Yeah.
just making it just a polite, safe response. It is easier
Yeah.
to
Yeah.
have a very honest conversation. Um, So it may
Yeah.
depend on what the exact issue is, but that
Yeah.
may be
Yep.
something to make the patient feel safe, and they may be more willing to share their information and make it quicker and easier to actually have an outcome that's good for them. Um,
Yeah. Yep. No, that
yeah.
makes sense. I think I've got one final question I'd love to ask you. And what would you recommend to people who are thinking about sharing their story? They haven't taken that step to do so. Um, be that, about a really positive experience or yourself where there was a great interaction or maybe something wasn't quite so positive. What would you recommend to people who are just on that ledge deciding whether to step out?
I think if you have the opportunity to be anonymous, you've really got nothing to lose. So
Mm,
you may well
yep.
have a change caused. You may well end up with better care. You may well just feel better after a little vent. um,
Yes, yes.
you know, and I think, let's be honest, no one likes receiving negative feedback, but if you can
Yep.
phrase the feedback you have as this is a problem with a system that you've got, rather
Yep.
than just attacking a person or anything like that,
Yes, yes.
um then that is actually a good and positive way to, I guess,
Yeah.
cause some change. But yeah, if you've got the opportunity to be anonymous, then you've not really got anything to lose, so why not? It's your
That's very
story.
true. We often hear it said that all feedback is gold. Even
Yeah.
if it might be thought of as negative, you look what
Mm.
you've done for the junior staff, those junior doctors
I
and
hope
other
so. Yeah.
patients. You've turned a situation around where it was, you started out quite distressed, and yeah, it's really, really come full circle.
Yeah.
Monica, I want to thank you and also to wish you well. Your journey
Thank
with
you.
your cancer is not over yet, but I really, really do wish you well, and thank you so much for your time, but also your courage in sharing your story and putting yourself out there like this. I think it's been really valuable for those who are watching.
Thank you. Thank you for the opportunity to share as well.
Beautiful. Thank you.